Joining us next is Dr. V. Mohan. He's the chairperson of the Dr. Mohan's Diabetes Specialist Center. And also with us is Dr. Rajiv Kovil, a general physician and a diabetologist as well. Dr. Mohan, let me come to you first. You just saw the entire reality check. I think nobody's really surprised by it. We all knew that it was happening. What we've managed to do with the Health Wealth team at the moment is just capture all of that on camera as evidence to tell people that A, do not, in caps lock and underline, do not self-prescribe. And also perhaps the question to the government on how will regulations come? How should they be enforced when in just a month's time, these drugs are going to become much cheaper and in another 6 months, they're going to be pills?
Yeah, thank you, Sonal. I was also horrified watching this. I did not know for sure that this is happening, but now from your report, I can see that it's actually a reality and people are able to buy it online, they're able to buy it without a prescription, go to a pharmacy. This is very scary, as was shown earlier in your program. There are a lot of side effects with these drugs. These are not drugs which like taking an apple or buying something else or even like buying a B complex. Even for those, I think there should be prescriptions because I have been taught in pharmacology when I was a student that you can be allergic to anything under the sun, including the sun itself. And therefore, when you're taking medicines, and that too powerful medicines, which work on the brain, these drugs work on the brain, they're not just working on the stomach. The number of side effects which have been shown, thankfully, they are not that common, but the common side effects are still there. The nausea, vomiting, diarrhea, constipation, loss of energy, these are very common. Most people have this, at least in the beginning stages. But in the more serious ones, like pancreatitis, stomach paralysis, occasional cases of blindness, thyroid tumors, all these have been reported in the literature. Thankfully, they are not that common. So certainly without a doctor's prescription and preferably an endocrinologist or a diabetologist prescription, these should not definitely 100% be used. They're not something like you go and buy a skipping rope in a sports store or buy a weight or something like that. Even that should be done under supervision, I feel, because there are people who die even after doing those kind of things in a gym and so on. So these are not things to be played about with, for sure.
Yeah. Dr. Rajiv, has this investigation shocked you? Did you know of it already? Now that you have evidence, what is it that you would like the government to do about it?
It has shocked me, but I knew this must have been happening because the sales are very, very high. Importantly, I think every prescribed molecule on a prescription should have a validity, and the chemist should be allowed to give that only as per the validity of the prescription. And if that is followed, then whether it is any GLP-1 or an antibiotic or anything, nothing can be abused. Because today a person is allowed to call up the pharmacy and get the medication he wants, whether it's an antibiotic or whether it's an antipsychotic or whether it's diabetic. I think once that regulation comes in place, then the misuse and the abuse of prescriptions will not happen. Today, somebody to whom I prescribed 10 years back could just call up and get an antibiotic, for example. So I think these are disease-modifying drugs that the doctor ideally goes through multiple algorithms to find whether the patient fits the right criteria for these drugs and then prescribes it. And it should be valid for only the validity of the prescription. He will write whether it's for 1 month or 2 months or 3 months.
But Dr. Rajiv, in India, that's not the case, right? It doesn't happen. Forget these very powerful drugs. Forget drugs that are costing almost 13,000 every week. 13,800 to be precise, every week. People are still buying it. There's an obsession with them. Which makes me think about, I'm sure you guys have anecdotes as well. Dr. Mohan, tell us, I'm sure patients are coming to you and saying, we want these skinny pens. How are you responding?
No, we have very strict criteria. And unless they satisfy a weight criteria, unless they are going to use it for a medical condition, purely for cosmetic reasons, we don't prescribe this. And only if it is indicated, only after a thorough evaluation, a baseline evaluation is done. For example, we talk about pancreatitis, so measuring as amylase or a lipase, looking at whether there's fatty liver, because even to assess the response, we need that. It's not just the weighing scale alone which is your fatty liver coming down, is your blood pressure coming down, is your sugar coming down, or your lipids improving. All that you have to see. Who's going to see that when you go and do that? And then similarly, if changes are occurring in the body, that also has to be monitored. So only strictly speaking, but then I think Dr. Rajiv Kovil brought up a very important point, that it's now because we're discussing a weight loss drug and it's a costly drug, we're discussing it. What happens, and paracetamol was shown, it's not like buying paracetamol. Do you know that taking paracetamol can damage your liver? So people don't know that. They think it's only a Crocin, it's only a Calpol, it's only a paracetamol. Even that on long-term use can cause damage. So I don't think any drug, for that matter, should be sold without a prescription or without.
I'm not sure if Dr. Mohan can hear me. So let me take this question. You can. Okay, great. I was trying to say this, Dr. Mohan, that, if somebody goes to a good doctor, like the two of you at the moment, I'm sure you will do your due diligence. But I also know of doctors who've told me they find it very hard to say no. Because every time they say no, this is what will happen. They will go and they will self-prescribe. So how do we draw the line here?
No, how can we? If you tell them not to do something and they go and do it, that's beyond our control. But I think to the doctor community also, warning should be told that unnecessarily don't prescribe. To the pharmacists, it should be done. Strict governmental action should be taken, I think, at all levels. And then the warning about these drugs, that they are not 100% safe. They are fairly safe, but they're not 100% safe. They're not without any side effect. That message, I think, things like this will definitely warn the public.
Yeah. Dr. Rajiv, share some experience with me. I was once sitting with an endocrinologist who told me that he was treating two brothers in the same family. Both the brothers were on GLP-1, but did not want their families to be told about it. Both brothers insisted that the doctor does not reveal their identity to the other brother who also comes to him. This is a very peculiar drug. It's got stigma attached to it because, let's face it, obesity is a problem. In India, it is the root cause of almost 90% of the other diseases that we deal with, right? This is something that we need to fight against. But is this the right way?
I think majority of these users are using it for cosmetic weight loss, and that's not what the drug is indicated for. Huh? Yes, and it is for type 2 diabetes and chronic weight management. That's extremely important. And also, what we have seen is that we start the patient on a 2.5 milligram dose and tell him to come after a month. And the patient comes after 5 months and he himself has up-titrated his doses. And that should not ever be happening. And two, as you asked Dr. Mohan sir about the abuse of the drug, now if the patient fulfills the criteria for an anti-obesity medication, then only he can prescribe an anti-obesity medication. Whether he has a comorbidity with the liver or a sleep apnea or a kidney, then only it's prescribed. You can't prescribe an anti-diabetic or an anti-hypertensive to a patient who doesn't have the disorder. So it's very important that we first recognize obesity as a disorder. We stage and classify obesity as a disorder. And then the prescriptions will be completely valid. And then the prescription will have weightage as we are treating many other chronic metabolic disorders. And that needs to be impressed to doctor community as well as our patient community, that this requires you to go back to the doctor, get it prescribed, and then go back again for a follow-up if you want to up-titrate or down-titrate your doses. It cannot be done on your own. That's what is happening, and that's a dangerous trend.
It's quite dangerous. Dr. Mohan, a lot of people, this drug, for the first time, it's made medical news become headlines.
Yeah.
For all good and perhaps also bad reasons. We have a lot of people in the country who are saying, ऐसा क्या कर लिया है इन सारे celebrities ने कि सब एक साथ पतले होते जा रहे हैं. और जब celebrities कर सकते हैं तो हम क्यों नहीं? People are saying when Serena Williams can do it, when Oprah Winfrey can do it, there are a list of, celebs abroad who have confessed to it. In India, they keep very shush about it, they don't speak. But we all know that they are on these anti-obesity drugs as well. So for a common person watching, they're saying, what are all these things? These people care about their life more than us. They have better resources and more connections and better doctors than us. How are they getting it? How do you answer that question?
Oh, they must be 100% getting it under medical prescription, because in those countries it is tightly regulated. You can't go to, I can't go to the United States as a doctor and say, give me an antibiotic. I can't get it. I've had actual situations where I had a diarrhea and I've just got off a flight and I said, can you give me something? Go and meet a doctor. If you have to meet a doctor, you have to take a 2-week this one advance notice to get that. I've seen how difficult it is to get a prescription. So if some of the celebrities you mentioned are getting it, 100%, 1000% they're getting it only under strict medical prescription. They're not buying it offline like this. And the other thing is, let me tell you that these drugs are fantastic drugs. Let's not belittle their importance. For years we have wanted to have drugs which can help you to lose weight. I've been in this field for 30-40 years now, and in the initial days they would lose 1 kg, 2 kg, and I would say, why are you taking a drug to lose 1 kg, 2 kg? We never had drugs with which you could lose 10 kilograms, 15 kilograms, and now with tirzepatide, Mounjaro, even 20 kilograms in weight. We've never heard of that at all. And anytime we had these drugs, they will be pulled off the market within 1 or 2 years. Some side effect will come and it will get banned. To the credit of these drugs, they have lasted now, some of them have lasted now 5, 6 or more years. And while the side effects are there, they've lasted. So we should give the credit to them. But that does not mean that you go and buy it off the shelf and then OTC and then you use it. That's very, very dangerous. And I must congratulate you and India Today for bringing this to the attention of the public, because I think it's high time we did this before many more people develop side effects.
Yeah.
Completely.
Dr. Rajiv, let me give you the last word here. I want to understand what exactly is the downside of getting on these drugs. We also speak to so many people who say that it's okay, I can afford to pay 13,000 every month to look skinny and I'll do it. People often don't understand that the minute you stop the drug, all of the weight, if not more, actually comes back. Do you want to explain that phenomena to our audience, please, Dr. Rajiv?
Yes. So let's not trivialize the science of these drugs by calling it just weight loss or cosmetic weight loss drugs. There's a lot of science behind it. It actually resets the brain, and it resets the brain and reduces the craving and the hunger. But having said that, these drugs are for chronic weight management. And when we say chronic weight management, it's a long term, and sometimes it can be lifelong therapy also. Now, whether we continue the patient on the same dosage or we go down on the dosage depends. So, as we treat any other chronic metabolic disorder, this also requires to be given that importance, and this requires to be long-term treatment. So, there needs to be a lot of follow-up tests which needs to be done, a lot of body composition which will change with this, a lot of dietary changes needs to be regulated. So there needs to be a lot of follow-up investigation which needs to be done, and seen that the patient, apart from losing weight, is also getting a lot of other benefit of weight loss. So just talking about weight loss is not enough. It's a completely disease modifying drug, and it continuously will need the hand holding of an expert all through the journey. That's what. Let's not trivialize the science. They're brilliant disease modifying drugs. Whether we talk about obesity or sleep apnea or the liver or diabetes or all of them, they're completely disease modifying. And for every percentage of weight loss, it's modifying something in our body. So it requires expert guidance and expert monitoring all through your life.
Yeah. Also, remember, these are, at the end of the day, these are medicines, right? Every medicine which works for your body has a side effect.
Powerful drugs. They're not simple drugs.
We also do not have long-term data on Indian bodies on what this will do.
No, long-term data, these drugs are only 5 to 6 years. We don't have 10-year, 15-year data.
We don't have that, and we don't have it specifically on an Indian, genome makeup. We don't know how it reacts to our bodies as well.
Correct.
So there's a lot that we still need to know about it. So before you jump on the bandwagon and think, hey, that's a quick fix, now I don't have to worry about diets or anything. Let me just, put this little skinny pen and I'm sorted. Think about the side effects. And please, I'm leaving all our viewers with this thought. Please, please go to a doctor, go to an endocrinologist or a diabetologist, and let them only understand your body and see if you're fit for this. Like we said, it's a miracle drug. It can really do wonders if you are the right fit and if you take it under doctor's guidance. On that note, thank you both for joining us on this very, very eye-opening investigation that we've had.